Welcome to the intersection of technology, cybersecurity, and society. Welcome to ITSP Magazine. You're listening to a new episode of Stories from Space podcast, where your host, Matthew Williams, examines the history of human spaceflight, the breakthroughs that revolutionized our understanding of the universe and our place in it, and the brave individuals who work tirelessly to advance the frontiers of our understanding. Knowledge is power, now more than ever.
The authors acknowledge that this podcast was recorded on the traditional, unceded lands of the Lekwungen peoples. Hello, and welcome back to Stories from Space. I'm your host, Matt Williams, and joining me today is a very special guest. She's an astronaut, an aquanaut, an emergency aeromedical transport physician, aka space medicine, a scientist, an explorer, an executive director, a pilot in training, a seasoned TEDx speaker, and a martial artist. Dr. Shawna Pandya, welcome aboard.
Thank you so much for having me on the podcast. It's my pleasure to be here.
Yes, well, I know this has been a long time in the making, and someone who's been following you for quite a while. I got to say, I was still really humbled and blown away by the long list of things that you've done, the credentials, the titles. So my first question would be, when do you sleep?
Honestly, I think every day is a little bit different. I'm often in differing time zones or meeting across time zones, so there might be a lot of coffee involved.
Coffee is good, yeah. However, thank you so much for taking the time today. So, as is usually custom, when talking to someone who's got a very long history of doing things, I'd like to ask how it all started for you. But first I wanted to mention, because this kind of surprised me, you are a black belt holder in Taekwondo?
Yeah, I'm a second degree black belt in Taekwondo.
Wow, with the WTF, I take it, just based on the spelling?
Oh, ITF.
ITF?
Yeah,
Oh my
ITF.
goodness. Me too.
Oh, that's great.
Yes, I've been doing that for quite a while, but not since COVID, unfortunately. Are you still training?
No, I last was competitive in about 2017. I was in the 2016 World Cup in Budapest. And then I was in a surgical residency for a brief bit after that. And so kind of deciding the value of a hand injury in surgical training kind of made me step away from martial arts. So now I just maintain my physical fitness in the gym.
Similar story, right on up to the hand injury. How curious is that? So, in addition to Taekwondo, you trained in Muay Thai and were competitive. And I also understand you speak multiple languages. How many are we talking here?
Yeah, so Muay Thai is something I've dabbled in. I've gone to Thailand to train in, fought in an amateur fight while I was over there and won. It was really amazing, just really cross-training between disciplines. I get a lot of value out of that. And then for languages, English, Gujarati, French, and then have dabbled in Russian and Spanish, but very, very rudimentary in those last two.
So, and I also understand you'll be flying to space on Virgin Galactic in 2026. And this will be with the International Institute for Astronautical Sciences. So are there going to be experiments for this flight? And
yeah, so I will highlight we'll be flying as early as 2026. Just because we are waiting on the Delta class of spacecraft to roll out and become operational. So I will temper it with that caveat. And definitely, we fly to space through research. We believe in microgravity as the next great research laboratory at IIAS. We've completed one successful research space flight in 2023. I was the medical lead and one of the lead scientists on that. We had 3 payloads focusing on physical sciences and biomedical monitoring, as well as glucose metabolism. And so for this next spate of experiments, we're actually in the middle of a down select. We held a global call for science between November 2024 and February 2025. And we have stated priority areas in women's health, neuroscience, health technology, supporting astronaut health, as well as healthcare on Earth, as well as physical sciences. So we will be announcing the results of that competition a little bit later this summer. And that will be the priority areas that we focus on within our crew, which is an all-female research crew, probably the world's first, as far as I've heard, with myself from Canada, Kelly Girardi from the US, who was our institution's first astronaut, and Dr. Nora Patton, an aeronautical engineer from Ireland, and Ireland's first astronaut.
And this will make you Canada's first female commercial astronaut. Is that correct?
Yeah, it
Wow.
feels incredible to say. It's not something that, I knew would be part of the journey, but it feels really relevant and really important because Canada has a history and legacy of excellence in astronautics, and I hope to extend that in the commercial sphere as well.
Amen. Talk up Canada, please, any chance you get. Yes, so naturally, this brings me back to, as I said, can you tell us a little bit about how you came to where you are today?
That's a great question. So I think my story might be relatable. Like a lot of kids, I wanted to be an astronaut when I grew up. And I was lucky enough to be a kid growing up in the 90s in Canada when we watched Dr. Roberta Bondar, Canada's first female astronaut, fly to space. And I thought, oh my gosh, Canadian women can do that. I want to do that. And so when you're a kid, you tend to oversimplify. And I thought, you know what? To do what Dr. Bondar does, let me study what she studied. So I knew she was a neuroscientist, a physician, and an astronaut. So I thought, okay, easy peasy. I'll go study neuroscience, medicine, and then go be an astronaut. And that was my trajectory, and it seems to have worked out well for me.
Well, yeah. So where did you study neuroscience?
Yeah, so I was born and raised in Canada. So I moved to Edmonton from Manitoba, Canada, when I was about a year old. And most of my schooling has been done at the University of Alberta. My neuroscience degree, my medical school and residency have been done there. I did step away for a year to do a master's in space studies at the International Space University in Strasbourg, France, which was career changing and life changing for me because I was lucky enough through that program to intern at the European Astronaut Center, one of the European Space Agency's divisions in the Crew Medical Support Office. And that was the first time that I realized that people make entire careers out of space medicine. So this was right before medical school, and I was bitten by that space medicine bug heading into medical school and viewed everything I did in medicine through that lens. And the rest just spiraled from there. So I guess the learning point from that is, well, it's twofold. It's first of all, to seek opportunities that may be off the beaten path. For me, it wasn't guaranteed that I was going to do this space university. I was accepted to medical school in the same year, and I thought, I really believe in this. Everything I've done has been for space. Let me ask the medical school for permission to defer. And they did. They believed in the opportunity. And so the second lesson there is go where you have permissive environments that will amplify your abilities, that will amplify your opportunities and catalyze the outcomes that you want to focus on. And I suspect if I had been at different medical schools, I would not have been granted that permissivity. So yeah, for me, just taking the road less traveled and doing so with the support of a wonderful faculty was really instrumental into getting me where I am today.
Yeah, and in fact, you also interned at NASA's Johnson Space Center. You've tested out commercial spacesuits in zero gravity, and that was during one of your many parabolic flights, I assume?
Yes, exactly. So, having this passion for space medicine kind of really set me up for opportunities that came one after another that really just snowballed. So, after spending that summer at the European Astronaut Center and then coming back to medical school, I really love this area of medicine to the point where I started up a space and extreme medicine club. I would go to conferences, would publish on space medicine and its opportunities to benefit the developing world. Was asked to make a book chapter out of one of my conference papers on that. And so, I kept just slowly growing my expertise and my track record in this area, such that when it came time to apply to be a Canadian funded by the Canadian Space Agency to go down to NASA, I was one of two Canadians selected. And, being at Johnson Space Center was like being at Disneyland for space medicine nerds. It was just incredible. So, always believe in the opportunities and the potential that they bring, and don't hesitate to take that, those opportunities, because if you don't, someone else will. And so coming back to your question about the commercial spacesuit testing, so this was through IIAS. So when I finished, or when I was in family medicine residency, so I started off in a neurosurgical residency, and then realized that, it's a wonderful field. I love all my experience and, the privilege of having people trust you to operate on their brains and spines. But at the end of the day, space is where my passion was, and neurosurgery was all encompassing. So I made the decision to come into family medicine and was all in on space, like very, very actively started seeking out space opportunities again. And one of these was the International Institute for Astronautical Sciences, formerly known as Project Possum, for those who might have been following the journey for a long time. And so I signed up for this program, not quite sure what to expect. I signed up for its first parabolic flight campaign where they had partnered with Final Frontier Design to test FFD's intravehicular activity spacesuits, or IVA spacesuits. And so at the time, you just want to do a good job. You're in this new program. Everything you're doing is pretty much building the spacecraft on the way up. And you just want to make sure that you are carrying out the maneuvers and the tasks and the protocols that you've been entrusted to carry out. And so myself and my partner, with whom we flew in microgravity together, with whom we were practicing all of the range of motion maneuvers, everything that we'd been tasked to do, we executed it. The flight was great, and then we got back down. We landed, and the executive director of AAS came up to us and said, I think you're the first crew to ever have tested a commercial spacesuit in microgravity, which was, just a cherry on top of the cake. It was just, not something, again, that we set out to do being the first, but it was just really wonderful to have had a successful test flight, and then also that accolade as well.
Yes. Naturally, I have to ask. So you've been aboard the Vomit Comet 12 times?
12 times, yeah, so far.
Yeah. So what's that like?
It's it's impossible to be in a spacesuit and not have a giant smile on your face. If you ever have the opportunity, I highly recommend it. It's liberating, it's freeing, it's very, very cool to be in the microgravity environment. Definitely, there's rookie mistakes you can watch folks who have less experience in the microgravity environment make. So, for anyone who ever flies zero G, highly recommend it. If you want to keep yourself from getting sick, make sure that you are not doing excessive head motions during the hypergravity or 2G pull. When you're moving your head from side to side, that's when your eyes and your inner ear really don't like that. And that's when people tend to get sick. And then the other rookie mistake I see is once people get into microgravity, they undo their seatbelts, they bound out enthusiastically, but you don't need that much force. You're going to hit your head against the ceiling. Really, all you need is fingertip pressure to maneuver yourself. So, if you can take those two pieces of advice into account for anyone who ever wants to fly zero G or aspires to be in the microgravity environment, hopefully that will help you out. Myself, Kelly Girardi, and Dr. Nora Patton will be flying to space with Virgin Galactic on a research flight, the ISO-2 mission, as early as 2026.
So, space medicine is a growing field, is it not? And in fact, it's one of several burgeoning fields that's coming up because, of course, all these plans for humanity's future in space commercialization of LEO, going to the moon to stay, building infrastructure there, going on to Mars, living and working in space. And in fact, this is something that I myself, I've got just a bit of an introduction with the High Alert Institute. Are you familiar with them? They are one of several places that are doing space medicine certification so that people can get training so that there can be such a thing as space doctors. Who else is currently working on that certification for doctors in space?
Yeah, it's a bit of a wild west out there right now. So right now, the only medical residency and fellowship opportunities that I am aware of are both through traditional routes like aerospace medicine, which focus more on the preventative aspects, and then the newly formed space medicine fellowships, which were kind of driven by SpaceX and the commercial industry and their need to have flight surgeons that were trained to deal with the new commercial space era. So now we also see we see space medicine fellowships out of UCLA, the Harvard MGH Spear program, through the UT Health program, and then I think there's also an affiliation with the Apex program out of one of the Arizona universities. And so it's, space medicine, as you say, is really rapidly evolving. And, the new areas of focus are being able to deal with procedures and medical pathologies as they happen in real time. And especially as we look towards two new horizons in space medicine. So both the rise of commercial spaceflight and the access to space that affords. So that brings a whole new population that would have potentially perhaps otherwise been medically disqualified through a traditional space agency selection, which for those who don't know are very, very rigorous, medical well-being starts at selection. So these astronaut candidates are selected very rigorously at the physiological, psychological, and physical health levels. And then the other far off horizon is looking at exploration class missions in deep space to the moon, Mars, and beyond. And so, at the level of the moon, you can still hope for evacuation in 3 to 11 days, depending on the transport medium. And your time delay is about 2.2 seconds, looking at the distances involved, and probably more close to 10 seconds when you look at the communication architectures. But then when you look at the Mars scenario, that involves a 6 to 48-minute round trip delay for communications, even traveling at the speed of light, depending on the alignment of the Earth and Mars. And then there's also a period in which the sun sits between the Earth and Mars, resulting in a 2 to 3 week communication blackout. So you really need to enable your crews to act locally, to be able to function independently under a term that we call Earth independent medical operations. So that's why we see the rise of space medicine.
Yeah, in fact, your words there, Earth independent. There, that is the name of the game when it comes to missions to Mars. So, bottom line, human beings on the moon. There is the potential for telemedicine. They can be evacuated if needed. Same, of course, I would say applies to LEO, but if we're going to go to Mars or anywhere beyond, there better be a doctor on site. Yes?
Yes, and so when we talk about the architecture, the medical architecture for Mars, who's destined to be on that crew, I don't think has been entirely determined yet. If you ask a doctor, of course, we're going to say, yeah, you definitely need a doctor. But the yes and comes from, well, what if the doctor is the one who's afflicted? And so there's a really cool document out there, last updated in 2019 from the then existent NASA Exploration Medical Capability, or XMC. And, there's this whole document that's called the Medical Concept of Operations for Mars. And then there's this really sobering table that talks about the different phases of a Mars mission. And it's sort of like when you're on the launch pad, medical event, can you evacuate? Yes. When you're in Earth orbit, medical event, can you evacuate? Yes. Trans-Mars injection and beyond, medical event. Can you evacuate? No. So this kind of really harps on the need to use emerging and enabling technologies, such as AI for diagnosis, for image reading, to be able to bring more diagnostic imaging capabilities with us. And it also has to abide by the packing considerations for space. So it has to be lightweight, low mass, low volume, low power usage, easy to use, be hardy, have a long shelf life, and require a low astronaut training time period. And so the virtual reality also can help by helping astronauts practice medical skills in VR, so to maintain and develop that muscle memory. So the example I like to use is practicing an IV on Earth and then not using that skill for another 9 months until you get to Mars. If you haven't practiced that skill, particularly if you aren't medical, your poor patient's going to look like a pincushion. So if you could maintain that muscle memory by practicing IV insertion in virtual reality, that can potentially offload that risk. And so that's part of it, emerging technologies, and then saying, well, in addition to a physician, who else might the crew need? Everyone should be ideally trained in first aid and CPR, and you might want to have someone who has at least a high functioning paramedic or nurse practitioner level of capability. So, I mean, these are just my own thoughts. There's a lot of cool literature out there. And, the additional questions you need to ask is, what are our allowances? What is the mission profile and duration? What is the size of the crew? And there's actually really cool medical modeling out there, again from NASA, that looks at, what is the risk of a major medical event happening over the course of this particular mission. And right now, the estimates suggest that at least one major medical event will happen per 5-year period.
Now, we talked a fair bit here about the medical training in terms of what basically physicians in space, what to expect, and so forth. One thing that I've heard a lot more of from speaking to, say, the Space Generation Advisory Council and also to the Hylard Institute is the legality, the lack of it, basically, right? Currently, there is no legal precedent or legal proceedings for how to deal with patients in space if, in fact, they're not astronauts, if they're civilians. Yeah, my understanding, limited as it is that aboard the ISS or elsewhere, the well-being of a crew member that's subject to the nation that sent them and their crew. Is that correct?
So there's a lot of ways to think about this. I will kind of I will speak to the regulatory and the ethical components of this. And so the challenge is, if you're a physician practicing, your job is to do no harm. And so that includes ethical questions like, what is the scope of practice? So if you have never been trained to do a thoracotomy and crack a chest, maybe you don't want to do that for the first time on Mars, or maybe it's something you learned once in training and you think it is a Hail Mary pass and you do engage in it. And so that's one thing. And so when we talk about scope of practice, one additional thing I'll add to our previous discussion is, what does the training for Mars look like? And so right now, most people are very surprised to learn that there is no guarantee of having a physician up on the International Space Station. You have a crew medical officer who once had about 40 to 60 hours of training, but as the astronaut curriculum has become increasingly inflated, that has gone down closer to 15 to 20 hours. So that's fine because you have 24/7 support from mission control. You can evacuate from the station in as little as hours. But when you go to Mars, you kind of need a little bit more expertise because you have less backup from Earth. And so coming back into this idea of scope of practice, if you had no medical training and you're not the crew physician or the crew paramedic, and you kind of saw a movie where they cracked a chest once, you probably don't want to engage in that. And then
Mm.
coming back into the other ethical quandary is this idea of futility of care. So even if you do crack a chest on Mars, you are a physician who's been trained on this. Then what? Like, where is your prolonged life support capabilities? Where is your OR? Where is your intensive care unit? Because maybe you've saved the patient within, the scope of a couple more minutes, but you need to have the infrastructure and the support and the resources to be able to support very a critically ill patient. And so that kind of becomes part of the discussion. There's a really cool paper out there put forward by the European Society for Aerospace Medicine on CPR guidelines and microgravity. And they discuss exactly this, like different astronauts coming from different cultures and customs are going to approach life prolonging measures versus resuscitation versus end of life care in different ways. So that needs to be respected. And then also the governing principle of not engaging in futility of care. Those are discussions that need to be had ahead of time. And then also the impact on the crew of choosing to end life-saving measures when you're maybe a crew of 6 on Mars, that will have impacts on the crew, whether you did everything possible to save your crew member or not. The entire crew is going to feel that morally. They're going to feel that emotionally, and it's also going to impact the work rotations. And then I'll just step back and also comment on the regulatory. So I was involved with a discussion on AI applications for space health recently. And there's a lot of potential, but there's a lot of pitfalls. So for example, you might have model drift as the AI tries to adapt based on what it's been taught on Earth, or you may not have an adequate data set because there's only been 700 people to space so far, and none of those have been in deep space, save maybe a dozen people. And it's very skewed towards men, upwards of 86% men. Or you may have a model that was trained on Earth that may not accurately predict physiological changes in the microgravity environment. And so chatting with one of my ESA or European Space Agency colleagues, she brought up the point that within ESA guidelines, the AI model that's approved on Earth is the AI model that goes with you. So even if there are changes that will accelerate and augment your crew's capabilities, if those weren't approved, those don't come with you to Mars. And some people out there might be saying, well, why don't you just upload it to the crew? Data management and the amount of data that you need to support for having a functional AI in space, you cannot support that with current Mars architecture. So there's a lot out there to think about. And it suddenly becomes apparent, why there's so much interest in space medicine and how it's evolving.
Yeah, you mentioned a few things there that got me thinking. In fact, when you mentioned training, you yourself, you're a commander of a Mars Analog Commission there at the Mars Desert Research Station.
Mhm.
And wow, interesting. You're one of a small handful of people now I've talked to who have been there. And yeah, so was any of that focused on the medical angle of things for going to Mars?
I think whether you're medical or not, the biggest takeaway I have learned by being a rural emergency physician, an aeromedical transport physician, being the crew health and safety officer on numerous analog missions, or even a commander, or even having been on a medical deployment to Ukraine, the people management and the interpersonal dynamics are super critical. So just kind of stepping back and talking about the 50,000-foot view to orient ourselves, how we think about challenges, healthcare challenges in deep space medicine. We call this the RIDGE framework. So that's radiation, isolation and confinement, distance from Earth, altered gravity, and hostile environments. So the crew dynamics really fall under the isolation and confinement. And so what happens best is when you can work with your crew ahead of time, where you can kind of fall into that model of forming, norming, storming, and then performing so that each other very well. You know how to recognize conflict and de-escalate far before you get into this isolated and confined environment. And so, when you talk about how you have a successful mission, I think developing a shared mental model for success is really critical. And so, if you're going with a space agency, if you're going with NASA, it's going to be pretty obvious from the start. You're going there with these scientific objectives, you're going there with these operational objectives. Depending on the analog you go to, those objectives may or may not have been set out for you ahead of time. And so for me, when I was a commander at the Mars Desert Research Station, we very mindfully sat down as a crew and then developed a shared mental model of success. And it ended up being, safety, science, outreach, fun in that order, because, you're not going to, everything follows from everything else. You're not going to be having a productive or even a fun mission if people don't trust in their safety. So really the crew dynamics become a huge part of whether a mission ends up being successful versus, being less productive. And I would highly encourage anyone who lives and works in any type of isolated, confined, austere, extreme, resource limited environment to consider that both within themselves and how they may adapt and with their crew.
So yeah, there's a lot of work to be done. Is one of the, I think, central messages that's coming from our chat here. There's a lot that needs to be done to advance the training, certification, and legal aspects of medicine in space. In fact, the aerospace medicine, to get back to what you were saying there is a legal framework for that, if I'm not mistaken. If medicine needs to be administered to crews that are still in Earth's atmosphere, it falls under the jurisdiction of whatever country they're over.
The
Is that
airspace.
the airspace? Yeah, of whatever country they're over. Interesting. But of course, out in space, yeah, different rules will apply. And I'm imagining, let's say there are multiple facilities on the moon, right? There is NASA has their Artemis base camp and maybe something more permanent. The European Space Agency has built their moon village. The Chinese and Roscosmos have built the ILRS. Is it conceivable that, yes, if you're in this zone, right, they have respective zones, then the legality is Chinese state law, European Union law, American law, etc. Is that a fair assessment there?
So there are some agreements. Some are older than others. And so we have, for example, on Earth, the astronaut rescue agreement. And right now, this is more within the realm of space agencies, where, if someone comes in on an off-nominal ballistic trajectory, maybe they had to evacuate from the space station and they land, in a off the nominal path. There are a number of signatories on to the astronaut rescue agreement saying they will devote resources for search and rescue and to rescue this astronaut. And so I have done a little bit of work in the astronaut safety and rescue area and have published on this. And the scenario that I like to paint is, okay, so say in addition to all of the actors, which are mostly nation states or agreements thereof, are on the moon, but we haven't yet talked about commercial actors. And so there's companies out there like Interloon who are proposing to go to the moon to extract helium-3. So, say that there is a lunar lava tube accident with one of the space agencies, and one of the next nearest entities that is able to offer help is a lunar mining operation. What is their duty to help? Or is there right now there is no binding agreement. There is no agreement on what the rescue of astronauts in space or deep space should be. And even when you look at Earth treaties, or if you look at the Moon Agreement or the Outer Space Treaty, these are all non-binding agreements. So even if you've signed on to this, even if you've signed on to the Apollo Accord, or sorry, the Artemis Accords, they're all non-binding agreements, but at least it's a start to fostering that dialogue. And so the most important part is to start thinking about these what if scenarios today so that at least you've thought about some of the contingencies and how you might rescue any truly in distress astronauts should it come to that.
Yes. And thank you for mentioning commercial mining and what have you there. Commercial interests on the moon, that's certainly going to be a part of any future permanent infrastructure up there. So getting to some of your other areas, some of your other accomplishments, you're not only a commercial astronaut and space medicine expert here, but you're also an aquanaut. You participated in what sound like some serious missions, and that includes the nautical experiments in physiology, technology, and underwater exploration, or Neptune, and then the Neptune.
Yeah,
So,
we just say Neptune 2 missions because if
yeah,
you're looking at the written word, it sounds exact same. Neptune versus
yeah,
Neptune, spelled with a
yeah,
2.
basically the sequel. So, this was researching medicine, physiology while underwater. Yeah, what did that mission look like? You were aboard a little submarine and
No, so there are these underwater dive complexes in the world. There used to be a very small number, but I think they're increasing now. So one of these is famously the Aquarius Reef Base, where NASA, CSA, ESA, JAXA send their astronauts to become aquanauts and again work on their crew dynamics, advanced technologies, and also conduct science. And so the Aquarius Reef Base is used for NEMO, which stands for NASA Extreme Environment Mission Operations, because we love our acronyms in the exploration world. And so we did our 2 aquanaut missions not too far away at a place called the Jules Undersea Lodge. So both are in the Florida Keys. They're about 13 miles horizontally distant from each other. So I was a part of 2 aquanaut missions, first in 2019 and then in 2023 as the crew health and safety officer. And that first mission was 5 days underwater. The second one was 6 days. So a total of 11 days, 10 nights underwater. And we performed experiments related to cortisol changes, salivary cortisol changes in the hyperbaric environment. We tested out novel technologies like doing the first underwater demonstration of a telemedical consult in a virtual reality radiology reading room. So as the career medical officer, I said, "Hey, I have this trauma patient. Can you help me interpret this shoulder imaging?" And I met with the head of radiology in Saskatoon, Canada, something like 4,600 kilometers away. And we reviewed the imaging and the pertinent findings. On our subsequent mission, we deployed the mixed reality point of care ultrasound underwater just as a proof of concept for this point of care ultrasound that is low mass, low volume, that can potentially augment our capabilities in isolated and austere environments. And then the other part of this is kind of what is going back to saying earlier about the importance of a good crew. So the Neptune crew is like a family to me. I speak with them most days. So 3 Americans, 2 Canadians, 4 men and myself, and coming from backgrounds of engineering, medicine, special operations, dive, and we in building this mission architecture and objectives, we worked together, for the better part of a year, putting the first Neptune mission together. And that really gave us time to figure out our crew dynamics. And such that once we got underwater, the mission was too short. It was so nice we did it twice. And I would definitely not say no to a follow-on Neptune mission because, the best crews become like your family.
mm, yeah, I'm still trying to picture it there. So you were underwater, you were in what, a pressurized volume? Or were you in
Yeah.
actual suits the whole
Yeah.
time in the
So
water?
the Jules Undersea Lodge is this H-shaped underwater dive saturation complex. And so to get to it, you have to scuba dive down. And then once you surface in this habitat. So Jules is at about 22 feet of depth. So then you come out on the moon pool on this porch. And so by virtue of being underwater and open to the surrounding water, you're at the same pressure as the ambient pressure surrounding you. So you're at about 1.6 atmospheres of pressure. And so then you come out into this wet porch, you kind of take off your dive gear, and then you have the two living arms of the habitat. So the H, like the middle bar of the H is kind of where you store your dive gear. That's where your shower and your bathroom facilities will be. And then on the one arm is the sleeping quarters. On the other arm is the kitchen and the galley and the common areas where you might meet, have your meals, do your science, do your crew building activities, do your outreach activities together. And so you're not wet the whole time. That would be really uncomfortable. But anytime you want to do an excursion, do some conservation work, do some science outside the habitat, you're gearing up in your dive gear.
Wow. Sounds really, really exciting. And yeah, the purpose of underwater training, because I've seen, I'm sure, like many people, footage of astronauts in training. They donned all their gear and they were immersed in this big giant pool, one of the NASA centers.
Oh
Yeah.
yeah, that's the neutral buoyancy lab. So we'll talk about that in a second. I'll just kind of finish my thoughts on the Aquanaut mission and the value that they bring. And
Yeah.
so you are living as if you are isolated from any nearby aid. And so the value of being at depth is that you have to decompress at a set rate lest you risk a dive injury. So now at 22 feet, it's not that big a pressure gradient. You can do your 30-minute safety dive, which is kind of your safety stop at 3 feet, which is what we did. But when you're at the Aquarius Reef Base, and I've been down there unpressurized, but I did some dive medical technician training down there. When you are Once you are at breathing the ambient pressure for 24 hours, you're in saturation. And so you need to decompress at a set rate. Otherwise, the nitrogen bubbles that are dissolved in your blood will come out too quickly and lodge in places that can cause serious harm. From the least causing maybe bruising and joint pain, or in worst case scenarios, causing seizures, coma, or even death. Causing seizures, coma, or even death. So to safely surface at the Aquarius Reef Base, you need to decompress at a rate of 16 hours and 47 minutes. By comparison, if you were to, in the quickest timeline, if you had to evacuate the ISS immediately, you could do so in as little as 3 to 6 hours. So you could actually get to definitive medical care more quickly from ISS than you could from the Aquarius Reef Base. So this is kind of why the value of living and training in these isolated, confined, austere environments becomes important. So now switching gears into other ways how we use the water world to help us train and prepare for space. You were asking about the pool at the Johnson Space Center, the Neutral Buoyancy Lab. So this is a 6.2 million gallon swimming pool that houses nearly an entire full-scale sized mock-up of the International Space Station. And so spacewalks are really high risk. They require a lot of coordination and a lot of practice. And so you don't want to do anything for the first time in the spaceflight environment that's risky, and it's expensive in this environment that's trying to kill you. And so what you will see the NASA astronauts and the ISS partners doing is donning in their full EVA, extravehicular activity spacesuits, and going through the motions of their spacewalk. And this can be, a 6 to 10 hour day easily. So they know what to expect, how the suit feels, how they're interacting with their EVA partner, how they're interacting with mission control. So the first time that they do it is not when they get out into space. And so at the International Institute for Astronautical Sciences, we have a baby version of an NBL, not 6.2 million gallons of a pool, but we do use a typical swimming pool, 14 feet of depth, and we have a simulated ISS airlock as well as a strut on which you need to latch yourself to. You need to tether yourself and your EVA partner are tasked to swap out a faulty module using the pistol grip tool, which looks like an underwater drill, to work together to coordinate with mission control and to successfully install a new functional module before making your way back to the airlock. And I've done this a number of times, and I find it so valuable because you really are finding the balance between working in this highly operational, high-risk environment, and you're working on your communications with your EVA partner, you're working on your situational awareness, you're really working hard to do this underwater, and you're also being task focused while also maintaining this sense of, okay, what's my air supply, where are we in the timeline, what's the next step, what can we absolutely not forget to do, so you're really getting that operational experience, and it's very, very valuable. So it's one of the other things I highly recommend for anyone who really wants to build that skill set is experience in the neutral buoyancy lab.
Absolutely. My final question for you would be, what's next for Dr. Pandya, and do you want it to include being a medical officer with the Canadian Space Agency who participates in a post-Artemis 3, post-Artemis 7, whatnot, missions to the moon? Is that something that we can 100%. Hope for?
100%. Okay. I am an explorer at heart. I've been in all manner of extreme resource limited environment. I've only loved it more with every experience that I've had. And so, for me, I am so excited. My current focus is on being the best crewmate and medical lead I can for the ISO2 mission. But I'm equally excited to keep advancing the frontiers of space medicine and exploration class human missions to deep space.
I would be, tickled and honored to see that happen because in part I could say to everyone, I knew her before she was doing this. And so I'd met and spoken to her, but above all else, I think it would be wonderful for you to represent Canada and space medicine, space medics on future missions. So yes, I want to thank you so much for coming on today, and for taking the time to talk to listeners here and to inform them about everything that you've experienced and learned, and especially about the need for planning, pre-planning, and fostering discussions about the future of humanity in space from a base medicine standpoint. Because, of course, how important is it going to be to stay healthy out there? We all know the challenges, right? Microgravity, radiation, etc. So I look forward to hearing more about your exploits.
Thank you so much for having me. This was really fun.
My pleasure. Tune in next time when we'll be discussing the Webb naming controversy, and where we'll feature an interview with Alex Longo, a planetary scientist at the University of North Carolina, author of Launch America, 2014 NASA Glenn Honor and Center Award Ceremony, who is also part of the team that contributed toward the selection of the Perseverance rover's landing site. In the meantime, thank you for listening. I'm Matt Williams, and this has been Stories from Space.
We hope you enjoyed this episode of Stories from Space podcast with Matthew Williams. If you learned something new and this podcast made you think, then share itspmagazine.com with your friends, family, and colleagues. If you represent a company and wish to associate your brand with our conversations, sponsor one or more of our podcast channels. We hope you will come back for more stories and follow us on our journey. You can always find us at the intersection of technology, cybersecurity, and society.